Greetings, my name is Bob Hindle and I'm with Neighbors for Life, and I thank you for coming to our website www.neighborsforlife.org. Now we get to the health insurance exchanges, and I want to relate this to a big mission of ours, namely to stop tax funding of abortion. Why does a healthcare insurance exchange have anything to do with abortion at all? After all, we know that in the House bill, the Stupak amendment, brought forward by Bart Stupak and promoted very strongly by the Catholic Council of Bishops, says there will be absolutely no federal funds used for abortions. Why then are health insurance exchanges problematical? Okay, let's look at that. Basically what a health insurance exchange is, when you take all the as the Germans would say, drumherum, all the stuff around it, and just look at what it really is, it's an insurance company. But it's funded by the federal government. Now the two ways this can happen. Either the state will take on the responsibility for the insurance companies and just take the money from the government, from the federal government, or the state will, so to speak, opt out. And then the federal government will set up its own insurance company within that state. In both cases, interestingly enough, there are federal dollars coming into that company. Now, what is the effect of that? Well, the drafters of this bill, this legislation, will say, well, that makes it possible to cover all these low-income people. Fine. There's another thing that they're not saying. It makes it possible for these insurance companies to undercut every other private insurance company. So, in essence, just as I mentioned earlier with JetBlue and some of these airlines that undersold other airlines, they will drive other companies literally out of business because a private insurer cannot afford to reduce their rates below a certain level. They simply don't have the capital to do that. The U.S. government, as we well know, money grows on trees. Taxpayers keep on paying their taxes, except maybe a few who are in the present cabinet. But certainly money grows on trees, and we have an infinite supply to fund these insurance exchanges. So you see the tendency. Over time, what will happen is we will get single payer systems within the states, which in effect means a single payer system across the country. Now, what does that have to do with abortion? Well, last time I checked, abortion was legal on a federal level. It is true that we have, thanks to Henry Hyde, the Hyde Amendment, which prohibits the use of federal dollars for abortions. But the Hyde Amendment doesn't prohibit sending federal dollars to insurance companies, state-run insurance companies that provide abortions. Aha! Something we missed there. So President Obama's promise that under no conditions abortions will be federally funded is a complete shell game as soon as we introduce these health insurance exchanges. Do the health insurance exchanges, by the way, reduce costs and increase access? Well, of course not. What they're going to do is bring about a single payer system which will have a sense of limited number of doctors involved, therefore rationing, limited amount of access, and of course the costs will increase because we'll have masses of uninsured people entering into it. This was tried in Hawaii, by the way, and failed. Okay, now we get on to the question, and I'm going to posit this. Some of you may have heard in Greek mythology of the Trojan horse. It was supposed to be a tremendous present to the opposing army to send this horse in. And of course what was in the horse were warriors from the other side, which then overcame the enemy. I would posit that this Obamacare is really not about healthcare reform. It is rather a Trojan horse to government takeover. Now, anytime someone says something like that, it can become rather a facile and dogmatic, hysterical claim without any merit. And I'm aware of that. I've heard people say things, you know, that the CIA did this and that and the other and all these horrible things, and maybe they did, but without any substantiation whatsoever. So I want to be careful when I make this claim that it's a Trojan horse to statism, to government takeover, that there's some evidence for it. The first thing that I would want to look at is, why is it, okay, we've just established that these proposed reforms in the current legislation, government involvement, mandatory insurance, Medicare cuts, health insurance, exchanges, do not solve the presenting problem. They don't decrease costs, they don't increase access, nor do they include some of the common sense approaches with competition, portability, tort reform, and Medicare and Medicaid reform. And the other interesting thing that we observed is over 60% of the American public is opposed to Obamacare. Why then are House Democrats, Senate Democrats, and is the Obama administration so dead set on passing this? What's going on? To that, I would answer, it is a philosophical, it is a dogmatic and ideological movement which goes back all the way to the French Revolution and before. There is a sense that the masses of people, the overwhelming bulk of the population, is uneducated, unenlightened, and that what it requires is an enlightened few to lead humanity back on the right track. Now, that is a very important point in terms of the way the Obama administration is proceeding here. Their notion is healthcare is badly bungled because of the private sector and because people are illiterate in terms of what is needed in society. Their solution is, we have a vision, government takeover, government regulation, committees, boards determining who can get what and when, and incidentally, sadly enough, who's going to live and die? Is it a preborn child? And that preborn child being born into a family that might become a social liability? Abortion. Is it an elderly person who's very ill and needs too much medical care? Rationing. And let's move them into hospice or euthanasia. And therefore, their overall basic point is that the government and their vision for society is the one that will lead us to a better world. Now, these experiments have been tried. French Revolution, Communist Russia. Again and again throughout history, we have seen these experiments been tried and they failed. Why have they failed? Well, as a person of faith, I would say because they're godless. That's the main reason they fail. There's no reference to God here. Everything is about humanity solving its own problems, but humanity left to itself will decay and fall into corruption, as we've seen with the Roman Empire and literally every empire that has risen and fallen. On a practical level, they failed simply because there's an absence of initiative. There's an absence of the free market system where people innovate, where they come up with new ideas. And absent that, what happens is you have the same old problems being rehashed, and eventually the system collapses. So Obama, via this legislation, and his colleagues, his Democratic colleagues, are convinced that they have the worldview that will lead to a better society, and this is what they are trying to implement in health care. That in itself is problematical. There are, unfortunately, other aspects to this whole ideological approach to health care that arise because of that attitude. And put in a nutshell, it is the ends justify the means. Let's take a look at that.